Chair Pranger, we're good to go when you are.
Call the meeting to order. Before we get into the formal part of the meeting, I would like to pay some tribute to Director Terry Raymond. So Terry was a valued friend, mentor, colleague, and a special friend to rural BC. As I think back over the years since we met in the early 90s, I am truly grateful for his friendship, but also think of his contribution to the Fraser Valley Regional District and the Fraser Valley Regional District Hospital Board. He accomplished much. For example, his work on the Gold Trail, pioneering the name change from the Local Government Association to the LGA to reflect that electoral areas and regional districts needed inclusion in our area association. He has long been an advocate for improved relations with Fraser Health, wishing for provincial health authority and wishing for the Provincial Health Authority and the Fraser Valley Regional Hospital Board to be a collaborative team, working together in true relationship. To honor him, we need to continue that work. He was even dedicated enough to chair one of the board meetings from his hospital bed. Rest in peace, our friend. Thank you for all you did and who you were. Thank you. Ms. Kinnaman?
Madam Chair, looking for approval of the agenda, addenda, and late items.
So moved.
Director Facio, Director Chahal. Those in favor, contrary, carried.
Item 4.1 is the Fraser Valley Regional Hospital District Board meeting minutes of March 17th, 2022.
Director Lum, Director Horn, those in favor, contrary, carried.
Item 5.1 is minutes for information. It's the draft Fraser Valley Regional Hospital District Capital Project Working Group open meeting minutes of February 22nd, 2022. Happy to answer any questions if there are any.
Director Siemens, Director Clute, those in favor, contrary, carried.
So moving down to item 6.1, we have a delegation from Fraser Health Authority with a presentation by Dr. Victoria Lee.
Welcome, Dr. Lee.
Thank you very much for your kind invitation, and certainly grateful to be here and joining you today. I'll start by acknowledging that I'm here joining you and conducting business on the unceded and traditional territories of Coast Salish people. And also on behalf of Fraser Health, I'd like to relay our condolences as well to Director Raymond's family. I had the pleasure of speaking, and he emphasized the importance of the collaborative relationship and also establishing ongoing and collective vision for what we want to see in our region as well. So thank you again for the opportunity. And I think really we're here today because of Terry's kind invitation at the time as well. So I know that we've got a very short time to present to you, and we've got a lot of decks, slides. So some of it we can use for information, and I'll try to walk through fairly quickly. And some of it will be an overview that you're quite familiar with. So I think I can do this in a fairly short order. I do have some of my colleagues with me that I'll introduce as we go through the presentation. So starting with Fraser Health, our population has grown. We provide comprehensive health services from acute care to palliative and rehab in over 20 communities and very culturally diverse communities of 32 First Nations and 5 Métis chartered nations as well, and some of the fastest growing regions in the country. The services that we provide are noted here, from surgeries to babies born to emergency departments. Every second, every hour of the day, there's certainly activity in Fraser Health to achieve our vision of better health and best in healthcare. I wanted to share some of the lessons learned because I think the last 2 years plus have impacted and touched all of us in different ways, and have also certainly changed our health system as well. And one of the things that we have learned throughout that time was how pace and flexibility and agility were so essential to response. And often I talk about how large health systems like Fraser Health sometimes feels like one of those cruise ships that can only move and move very, very slowly and changing direction. But I must say we were moving direction and being able to actually change our, I think, our services in a manner to ensure that we were responding to the pandemic and extreme weather events in an agile way, like a skidoo instead of one of those very large cruise ships. So whether it's some of the examples that are noted here from case contact management or long-term care response to COVID, or doing something completely different like helicoptering clinicians and patients equipment on a day-to-day basis during the flooding events, and the overwhelming and heroic efforts of the Fraser Health family during the immediate care of transfers from people that were coming from Lytton during the wildfire season as well. People say that data is the new currency. I tend to now think attention is the new currency, but thinking of data as our currency, health has quite a bit of currency in terms of health data. And we've been able to leverage data during the pandemic time for rapid decision making and mobilization of resources. And, you know, when we were looking at how do we respond to the pandemic in terms of testing, vaccine, those types of actions weren't taken just from guesses. We looked at all of the data that we have, looked at some of the linked data that we have with the communities and our partners to ensure that we are utilizing our resources to ensure biggest impact. The other thing that I'm very thankful for is all the community partnerships for engagement. And I think especially during this time of social media and some of the other communication channels, it's really difficult with misinformation and disinformation that's out there. By partnering with municipalities, with communities, with academic institutions, we were able to really ensure that there's accurate factual information that's out there to serve our population, but also to ensure that you are equipped with information that you need to engage with your population, and as well as special populations that require different and specific support as well. Partnerships that I mentioned also, I think, kept us honest in creating new solutions and challenging us to look for different opportunities. And all of the partners, and not all of them are listed here, but those are some of the examples of how we not only leverage existing partnerships, but also took on new partnerships as well. And all of that wouldn't really matter if we weren't really basing those solutions on patient, family, and community center services. We really need to ensure that our services are wrapping around patients and families and communities, and that they're not siloed and disconnected. And some of those things we were able to close a gap during the pandemic, whether it's virtually linking pre-surgical services to ambulatory services to online automated services that made our health services much more accessible and friendly than previously through sometimes quite aged fax machine or telephone calls only types of services. And I think we did a lot of work to ensure that our services are culturally safe, and those that need extra support, whether it's Indigenous population, having specific clinics, or meeting people where they're at, whether it's truck stops to shelters to beaches, we were there to meet them with comprehensive services, not only connecting them to COVID services, but primary community services at the same time. I'm going to hand this over to now one of our VPs, Brent Crucial, to talk about some of the highlights of recent investments, which you have been very kind and generous to partner with Fraser Health on.
Thanks, Dr. Lee. And again, I just want to take a moment to express my condolences on the loss of Chair Raymond, and also my gratitude that he made this event happen. It's very nice to be in person and not on the other end of a computer screen. I appreciate that. Many of you will be familiar with these investments. Some of these are underway, some of them are planned, some of them have already completed, but I'll move quite quickly. Just starting in Abbotsford, emergency department expansion opened up, boy, it's almost a year ago. A great project there. OR integration, thank you for your support there. I won't read those, but I just want to touch on a couple there. Land acquisition at Marshall Road. This falls in the category of strategic land acquisition. This will come up again when we talk about what's going on in Chilliwack, and not immediate plans for the property on Marshall Road or the property in Chilliwack, but this is something we do when we can find adjacencies to existing infrastructure. It just creates long-term value and options, more importantly. Also, thank you for your commitment on the future capital investment at Abbotsford long-term care projects. I look forward to the day when we're there to cut the ribbon on that facility, because we've been talking about it for a long time. And my hope is that we receive our approval in June. Just some photos of the OR room integration and some of the work there at Abbotsford Regional Hospital and Cancer Center. That's an artist rendition of the Abbotsford long-term care project. Of course, we're in planning there. We don't have the approval right now. And to the right of there, that's a 4-bed long-term care room at Cottage Worthington. That room's in use today. And if I can, we've talked about the pandemic and some of the changes coming to long-term care. We need to move away from that model. That's very difficult to contain outbreaks with 4 beds in a single room. And happy to say the new Abbotsford long-term care project will all have single bedrooms. And then just highlighting there at the bottom, the Marshall Road land acquisition, and you can see the adjacency immediately to the hospital there. Looking at Mission, really excited that the CT scanner project is underway right there. We're in design right now, and hopefully we'll undertake construction in short order. And again, numerous infrastructure projects. Given the vintage of that facility, the infrastructure projects are continuous, as I'm sure some of you are aware. Chilliwack, several upgrades, pharmacy sterile compounding, mammography room renovation, sacred space. Just lamenting the challenges of the current market conditions. A lot of these projects are conceived and planned and have a business plan submitted. And unfortunately, it can sometimes be 6 months to 18 months before we're able to tender that work. We tendered the sacred space and mammography room renovation together, and unfortunately, typically we would see 4 to 5 responses to complete that construction. And I know you're probably seeing this in your respective municipalities and areas as well. We had 1 response. It's about 40% over our estimated capital costs on that project. And I know this is not unique to Fraser Health, but this is just highlighting one of our challenges in the current world we're in. And of course, future capital investments there. Again, the Bradley Center replacement. Looking forward to that ribbon cutting in a few years' time. And also highlighting just happening now, just closing, is a Chilliwack land assembly purchase. Again, strategic land acquisition adjacent to the hospital. No immediate plans for development there, but just creating opportunities for us going forward in these communities that are growing so rapidly. There's the artist rendition of the Chilliwack long-term care project. Again, in planning, we're awaiting approval. Highlight of the land acquisition as well. want to talk about Hope. We've got the helipad out in Hope, and unfortunately, due to really a lapse in licensing and lack of use, we weren't able to leverage that helipad during the floods. And we've recognized that while there may not be a regular need to move patients in and out of that facility, at a minimum, what we need to do is upgrade that pad and get it certified for use in emergency situations. So that work is underway right now. And also note, working, of course, closely with the community there on stabilizing the riverbank, which threatened to eat away half of the parking lot there in Hope at Fraser Canyon Hospital. Just regionally, what we're looking at, not really specific, but long-term care for all facilities in this region, significant money. This is Fraser East. HVAC upgrades in our long-term care facilities, new mattresses and beds, furniture and fixtures. We're able to leverage some federal funding that became available. We were ready to actively pursue that funding and invest it in existing long-term care sites. A lot of additional equipment and for COVID related purposes and surgical as well. With that, I'll pause. I'll turn it over to my colleague, Norm Peters, to talk about some of the challenges we're facing. Thank you.
Thank you, Brent, and good evening again. Thank you very much again for the kind invitation. Tough act to follow when Brent gets to talk about investments and I get to talk about challenges, but that's okay. Prior to the pandemic, there were two priority populations that we were focusing on investing, and that was for individuals in the community with mental health and substance use issues and vulnerable seniors. And we were making investments in those areas. But unfortunately, what we found during the pandemic and the subsequent climate events is that those are the same populations that were at greatest risk during those events. I'm sure you've seen the stories about the impact in long-term care, the number of outbreaks and the unfortunate deaths associated with COVID-19 in long-term care, and some of the issues that we were working to address in the community, such as the overdose crisis, actually were compounded and made even worse during COVID. We're now 6 years into the other longstanding healthcare crisis, which is the toxic drug supply in this province, and it's getting even more toxic by each day, which makes our response even that much more complicated. And unfortunately, last year we hit a terrible number in terms of the number of deaths associated with overdoses. 714 British Columbians that were members of people's families. They were sons, daughters, mothers, husbands, families, aunts, uncles succumbed to toxic drug supply. So that just adds to the challenges that we're experiencing. And we are, though, taking some concrete steps towards that. So in the areas of response in terms of mental health, substance use, and overdose, we are continuing to invest in improving access to things like rapid addiction access clinics. So here in Fraser East, the Riverstone project was, we increased the resources to it and turned it into a rapid access clinic out of Chilliwack that serves as a hub and spoke where people are able to access in the moment supports for addiction treatment. And in areas like our overdose response, we continue to move forward with overdose prevention services and health contact centers, which are focused on initially harm reduction, but then also connecting people to vital and critical support resources, such as mental health services or substance use supports, so that we can help people with whatever substance use issue that they may be experiencing. We do this work in close partnership with our population and public health department. Our medical health officer, Dr. Elizabeth Broadkin, and myself help support the work in communities with a goal to initially reduce harm, but also then gain access for treatment and services for individuals in the community. Another area of focus, which I talked about, was for seniors. We know that we have a rapidly growing and aging population in BC. It's a great place to live, and many people choose to come and retire here. But with it, though, does come challenges in terms of meeting people's care needs as they age and grow older. What we found is that the services we often are often fragmented, not very family friendly or client focused. very difficult to navigate. Even individuals in the healthcare system can have troubles finding their way through the system to access care. And our goal is to create more integrated approaches so that there is only a single point of contact for people to be able to access important services for family members in the community. We want to be able to help support them through things like adult day programs, support families with respite services, connect them with home health, home support, and do it in a coordinated way so it's not as fragmented as it is right now. We also recognize, and I'm sure you've been seeing in the news, there's a lot of concern around ensuring that people have timely and ongoing access to primary care. There's, as the last numbers show, between 700 and 900,000 British Columbians unattached. And we're working with our divisions of family practice to implement primary care networks, which are networks of care where we've got team-based care that are more than physicians. We include nurse practitioners, social workers, and other allied health professionals to better meet people's ongoing and longitudinal care. And we're opening up urgent and primary care centers. We've recently, we opened one in Abbotsford before the pandemic, but unfortunately it was then shifted towards a pandemic response, but it's now back to being an urgent and primary care center. Those are going to be critical parts of our plan going forward, but it does present a challenge in terms of our health human resources. Which is one of the things that we're focusing on, is how are we going to recruit, retain, and train the workforce for the future. And that is probably one of our biggest challenges, is making sure that we have enough people to do the work that we need. We know that recovery from the pandemic is impacting many people, and we expect that we will see the effects of the pandemic, especially around mental health, for many years to come. The socialization, the disconnect. I myself thrive on being around people, and very much enjoyed actually being here tonight, where I can talk to people face to face. And I know for many people, socially isolating was very difficult and has had an impact on their health. And we will be feeling those effects for the years to come. So we need to help provide supports. And as I mentioned before, the social determinants of health around things like housing, poverty reduction, health literacy, those things came into sharp focus during the pandemic, and those that were most vulnerable were due to social determinants of health were the ones that struggled the most during the pandemic, subsequent client events. And truly addressing systemic racism and moving to true reconciliation with Indigenous people in our First Nations communities is a challenge, but a priority for Fraser Health. And I'll now turn it over to my colleague, Lori.
Okay, I also thank you for the invitation. So I get to turn Norm's challenges into future opportunities. And so I just pulled some of the headlines that you're probably all very familiar with. The pandemic was hard. It was a hard 2 years. And not only did we suffer through the pandemic and whatnot, but we also were faced with the heat dome and the flooding. And there was really very little downtime in between those disasters. So you'll see, health worker shortages are immediate concerns post-pandemic, and we are seeing that impact right now. And as I said, we've turned those challenges into opportunities. And I give you an example here of Abbotsford Hospital, and Abbotsford played a very important role during the pandemic. It was one of our 3 higher level of care sites that received COVID positive patients. We even received patients throughout the province to Abbotsford and helping out the entire province. In that pandemic, we actually trained 35 ICU nurses in a very short amount of time, and 14 what we call high acuity nurses. It's a little bit lower acuity than ICU. We also trained about 38 specialty emergency nurses, and we continue to do so. And what it did, it challenged us to look at how we trained our staff differently. We did a lot of internal training programs, and we like to say we're starting on a journey called the Fraser Health University. And that's something that we'll need to take into the future, because we're not going to hire ourselves out of this. We are going to have to train and ladder different levels and skilled staff through our system. With that comes some innovation. We need to think about things differently. How are we going to explore recruitment and retention, especially differently? You might have seen some staff, especially in Fraser Canyon, we've had traveling nurses to fill some of our gaps. We might have to look at some accommodations on site for some of our staff or staff that travel between our own Fraser Health facilities. So that's something to explore. Not only nurses, we're talking about physicians now, we're talking about lab technicians, radiology techs, you name it. We are facing a healthcare shortage. The other thing that Norm mentioned was GP shortages, and you know, primary care is really where we need to spend most of our time and focus going into the future. We can't have every door leading to our emergency departments. You hear about our emergency departments overflowing and full of patients, and that's not necessarily the place they need to be. They need to have longitudinal primary care where they can be proactive in their care. And so that will avoid them landing into our emergencies. So we're investing in urgent primary and community care centers. And Norm spoke earlier in Victoria about looking at other systems and structures we can put in place to keep people at home as long as possible and support our patients in the community. And the other thing that comes with that is caregiver support. And I don't know about you, but I'm in the mid generation where I'm looking after elderly family at home, and it's hard, right? You have working people that now have to look after their parents at home. How do we support them and actually train them or educate them on how to look after their loved ones? Need for innovation. We cannot, as I mentioned, we're not going to be able to manage all of the impending patient load that is coming towards us as the population grows and the demands increase. So we need to maximize our technology. And I was speaking to some of the council members at dinner time around, you know, we can do a lot with home health monitoring. Everybody nowadays has Fitbits, iPhones. There's a lot of technology that we can deploy, and we're thinking of and in the planning processes right now of doing home monitoring in a hospital at home is a concept that we're launching, starting with mental health, where we can monitor patients at home in their community and avoid them landing in hospitals. So one of the things Fraser Health is doing and looking into the future is investing in our clinical information systems and our virtual care technology. And I think there's a lot of opportunity and possibility in that realm. And finally, I spoke to, you know, not only the pandemic, but the other things that we're facing and that we will continue to face. And Victoria at the beginning of dinner mentioned that these are going to increase probably in frequency with our global warming. But we really need to enhance our community partnerships. And it's so great to be here with you guys today to work on those relationships, because we really can't do this without one another. I recall the case, and you probably saw it in the media as well, the young boy in Fraser Canyon, where we moved heaven and earth to get the critical care team out to him. And it was great making that phone call to one of my ICU doctors in Surrey and said, well, if we can't get him to us, how do we get him there? And we relied on the Abbotsford RCMP to help escort the team out to Chilliwack, I think it was. They got the rail car and they got all the way out to Hope. So it was just a real heartwarming event that happened, and it just proves that we do need one another to get through this. So I think I will leave you with that, and we'll turn it over for questions. Thank you.
Questions?
Sylvia.
Director Klug.
Thank you. Thank you for taking the opportunity to be with us this evening and to share your presentation with us. One of the things that struck me is you project healthcare retention and healthcare professional shortages. Yet we are seeing still in British Columbia, and I'm wondering if Fraser Health is initiating any conversations with the provincial health officer that unvaccinated medical personnel are not, they're basically fired. Has there been any talk of that being rolled back? Like they mentioned at the time that chiropractors and dentists and whatnot was coming down the tube for them as well, but they backed off of that. And I'm just wondering, has there been any talk of looking at this again, simply because I think there's 3,000 people in the province who've been laid off. And I'm just curious if it just seems kind of weird that we're facing a shortage, yet we have all these professional people able, ready, and willing to get to work.
Thank you for that question. I think that's provincial health officers order that you're speaking about. And I think it's, it's a very difficult decision to balance some of the benefits versus challenges. And I think the concern was really around both spread of disease, but also protecting our health system. And how do we best do that by having a healthier workforce that's protected from COVID? And right now, the direction is still also to have that public health order in place. But it is something that, of course, the provincial health officer and the ministry reviews regularly. And is looking at regularly in terms of balance of risks as well as benefits.
Oh, I think I had the microphone. I was in the queue, so I think that's why. But I'll defer to Director Popoff and come on later on.
Okay. Thank you for that. Thanks for the presentation. A comment and a question. I can remember vividly that Monday morning when you called me at City Hall, and it is after the 2 feet of rain that we got. If you need anything from me, just let me know. And at that point in time, things were okay. And I think within an hour, my phone lit up with, my dad has to get to Abbotsford for his dialysis and a few other things. And I called you and you mobilized your team and you got it done. I want to thank you for that. That's teamwork. Very impressive with that. The folks that phoned me back and thanked me for that work, but it wasn't my work. It was your work and your team that did that. So thank you again. That was great. And my question, is there an update on the Evans Road Parkway Clinic that's been proposed? Is that, we've had conversations about that in that primary care. Yeah, is it?
So I'll maybe start with the first part, and thank you for that. And I think certainly we've seen some heroic and extraordinary commitment and work and working together. So really happy that we were able to respond to the needs of our patients and families during that crisis. And I said, we became experts in helicoptering equipment, clinicians, and all kinds of things during that time, but it was all due to collective support and work. I think that's the primary care
Yeah, I'm sorry. Yeah,
center that you're
yeah,
referring to in Chilliwack. And
Yeah.
I think that's still under development from my understanding, but
Okay.
it is something that with priority in the community and enhancing primary care is one of the priority areas, and certainly an area that we're looking to rapidly progress on.
Okay, so there's no time frame on that at
I
this
don't
point?
believe so. No,
No,
not
okay.
yet, but we'll update you as
Okay.
we get more concrete in our timelines.
Thank you, Doctor.
There we go. We remarked earlier on the wisdom of Chair Raymond, and one of the things I recall him saying was the need for us to take an approach that is research and evidence-based as opposed to one that's purely political in terms of serving the healthcare needs of people in all of our communities. And so my question is about regional health needs assessment and really understanding not just the capital and infrastructure needs of our region, but also how we might improve interdisciplinary and collaborative practice. I came from a homelessness forum last evening in our community, which in a word seems daunting. And I think spoke to the need for us to really examine closely the way that we deal with complex challenges. And it strikes me in your presentation as a team tonight, talked about the lessons we've learned, the opportunities that have come out of COVID. And so my question is this: has Fraser Health got a schedule or a process that it routinely uses for doing a regional health needs assessment? If not, is that something you're countenancing at this point? Second part of that question is, if you were to undertake that work, would Fraser Health be able to work in collaboration with the regional hospital district in terms of sharing that work and sharing that data? So I'll leave it at that.
Yeah, another excellent question. Thank you. I think we do needs assessment in different forms and different times. And sometimes we do a deeper dive into needs assessment for specific program areas. For instance, in mental health and substance use, we've recently done that to see what kind of services do we need, and especially in tackling toxic drug crisis. Sometimes we do that for instance, for surgical services. So I'd say we have different layers. So sometimes it's specific population oriented, and sometimes it's specific service line oriented. We do also engage in kind of regional look at what are the demographic changes we'll see in the future. What are some of the changes that we might need to make from a regional perspective to better provide our services across the whole region. And you heard from my colleagues this evening how important that regional network structure was, that, we're not working as Chilliwack Hospital in silo. The only way we actually were successful in providing care was Chilliwack working through the whole region of Surrey to Abbotsford to Hope. So I think there's different layers of that, and sometimes it's much more engagement heavy because we want to make sure that we're detailing all the service lines accordingly. Sometimes it's more demographic census and kind of data heavy, and of course every opportunity that we have to partner with you, we will do so.
Director Lum.
Thank you, Chair Pranger. My for comment and a question, first a comment and a thank you. And I didn't see Director Mercer, who chairs our Community Safety Task Force at the City of Chilliwack, put his hand up, and I feel bad stealing his thunder a little bit here, but one of the recommendations coming out of our Community Safety Task Force was an increase in outreach services, and Fraser Health really stepped up in that vein in the last a little while, providing some outreach services into Chilliwack area. And we've just heard some just absolutely wonderful success stories as a result of those services, and them joining some of the team that we've, the City of Chilliwack and the RCMP have had out in the community. And these were taking pressure off police, what are traditionally police calls, and moving them over to outreach professionals, mental health professionals, peer support workers, and we've heard some really early positive results. So I just wanted to thank you very much from the bottom of my heart, because we've seen really marked difference in the last little while. The second is a question around, you mentioned some taking advantage of some federal dollars that came through, and it looked like the majority of those items were items that we may have expected to show up on our small capital investment list. And I'm wondering, does that take some pressure off of some of the small capital asks that you come to the hospital district for?
Yeah, we did have a wonderful opportunity working in partnership with our provincial and federal government, where there's some infrastructure dollars that became available for long-term care, for instance, and whether it's updating our beds or some of the equipment, air conditioning, ventilation, we took the opportunity to be proactive, and we were able to secure quite a bit of funding in that area. So I think it'll take pressure off of updating those needs, but of course there's always competing priorities overall. So we hope that with the same amount of resources, we'll be able to do more, given the support that we were able to get through the federal and provincial partnerships in that.
Thank you for your answer.
Thank you. Director Falk. I'm sorry. I'm sorry, Carol.
Hi. Just a question around logistics, Dr. Lee, when it comes to moving towards the healthcare system for seniors of staying in our homes. So will there be sort of a place where the families can go to access that information, a simple way? Because oftentimes you'll hear, I didn't know that was available, or I didn't know how to access that. So just looking to see that there's going to be an easy way for families to do that.
Thank you. That's a very important question because as Norm mentioned, that's sometimes very difficult to navigate our health system. And we don't mean to make it difficult. It's just that there's such complexity sometimes of different service lines. And one of the key areas that we're really working on is how to make it as simple and accessible as possible. And the information might be one interface, whether it's just one phone number, website, there'll be chats that are available, but information that's readily accessible for people that can pull information, but also we can push out the information through our municipal community and other partnerships as well. So certainly we want to ensure and leverage the communication and partnerships and community engagements that we've had to share the kinds of information that you're looking for. So very interested in that area and would love to partner more in that to ensure that families have what they need to care for our seniors at home.
Thank you. Director Folt.
Thank you. Just following up on Director Klute's question about the staffing issues. Have we looked at the challenges to healthcare as a result of not having these nurses and doctor shortages when we think of all that we've laid off? Have we actually done a study to look at what are the long-term effects to our healthcare because people are unable to access timely treatment or timely care? So have we looked at that? Because we talk about the risk benefit. And from my perspective, I'm hearing a lot of people in my community say they're just not able to find a doctor. They're not able to get the care. They're having challenges even getting into clinics. And so what's the risk benefit ratio there?
Yeah, another important question as we talked about, some of the challenges in health human resources. And I think when we certainly don't have a long-term study yet, but when we looked at the kind of pressures in our system, over 99% of physicians were immunized with the 2 doses. And I believe it was also quite significant in over 97% of all of our workers. So in terms of immediate impacts, it wasn't as significant for Fraser Health system, but of course every human health resource is valuable, and we want to make sure that we leverage and give everyone an opportunity to work within our setting as well. So I think all of those opportunities were also provided during that time. In terms of overall long-term, how do we address the crisis of challenges that we've mentioned? I think one of the areas that we're really paying attention to is what Lori Leith had presented, the training that's required, the laddering and the team-based work. That's really going to give us the bigger impact in terms of how we're going to be able to continue to provide care that's required in our health system, whether it's critical care, emergency department, or home health, home support services. We're managing and actually growing and learning from our health system to provide better care by team-based care, using technology and making the services much more accessible for everyone. So I think it'll be hard to tell right now what the overall long-term impact will be. Of course, there were impacts from the short term, but I think long-term solutions lie in some of the solutions that we presented this evening.
Director Siemens.
Thank you. I appreciate the challenges that you face, just from staffing, but also I guess when I take a look at the mental health component and some of the challenges with substance abuse, one of the challenges that we have when we find housing through BC Housing is trying to keep people housed. And a lot of our outreach, we really appreciate, as has been said here, the outreach has made a tremendous impact. One of the challenges that we're finding in the city of Abbotsford is finding the appropriate staff, keeping staff motivated, but also the staffing hours oftentimes are during the day, and what we're finding is we actually need them more in the evenings, and I know that those are real challenges. But the
oftentimes the patients don't understand that they need care. And so we're dealing in a real challenging situation. I'm just wondering if you could elaborate a little bit on how you're working with BC Housing and maybe what some of the future plans are.
Yes, another important question. Thank you. Mental health, substance use patients and clients that we've had, I think the impacts of COVID and the pandemic, extreme weather events, more vulnerable people were impacted even more during this time. So certainly have seen some devastating and heart-wrenching impacts of the pandemic as well as toxic drug crisis. I think one of the areas that we've really focused on is our partnership with BC Housing, but also with our communities and municipalities. And fortunately, with provincial government support, for instance, in Abbotsford and Surrey, we were able to launch complex care housing and support for complex care patients. So we've expanded our services in that regard. We've expanded our services in extended and outreach services as well. During COVID, we also had quite a significant isolation centers that were dedicated with significant resources to provide integrated care. And we're expanding our services in terms of outreach, intensive care, in terms of integrated case management types of services, but also much more of connected care, because sometimes we do have resources that are available, but they're not necessarily connecting we're not connecting the dots as well. So for instance, in Abbotsford, again, we have now expanded primary care with services, as Norm had mentioned. It's opened up as testing in the beginning, but now it's a full-fledged urgent and primary care center. We also have iHeart outreach service that's right beside there, and we can connect the dots so that we can provide community care, primary care services, as well as mental health and substance use services by connecting the dots better. And I think we do have some room to improve in ensuring that the services are much more 24/7 types of services, because I think sometimes what happens is the only option then is emergency department that's open 24/7, and that's not the best care model for the kinds of patients that you're talking about. So I think there's connection that we need to do and flexibility that we need to build. And that's an area that we're working very closely internally, but also in partnership with BC Housing community organizations and municipalities.
Director Shahal.
Thank you, Chair. I'm just reflecting upon the last couple of years. There's been so many challenges, but also there's been opportunities of hybrid models. And so is that something that's going to stay with us? I'm just looking at other government agencies too. It's almost as if we didn't have to adapt, and it's disappearing really quickly. So I'm wondering if you can speak to that.
And just to clarify, you're talking about some of the changes in terms of virtual and those types of things. Okay. And another important question, and Lori had touched on this quite a bit during her presentation. Fraser Health was actually first to launch our pre-surgical virtual care model, and that enabled us to actually quickly and rapidly and seamlessly catch up with some of the COVID postponed surgeries during that time, because it just introduced another efficiency, but it was also much more patient-centered because we didn't need to have people travel during that time. So we'll certainly continue to build on that. And I think the key here is to ensure that high quality services that need to be in person continue, but those that can occur in a virtual fashion, we're able to mix that model. And what we found in our ambulatory clinics, for instance, so it's about 60-40 type of split really worked well for monitoring ongoing, but ensuring that new or complex patients are taken care of in an in-person manner, and tying that with home monitoring, some of the group services and support services for mental health, we're actually seeing much greater continuity and uptake and less cancellation. So I think what's very important is that we evaluate and monitor, and going back to evidence, ensuring that we're following evidence in terms of what's been effective, and we take the benefits of technology and virtual care, and also benefits of in-person meeting by, I think, that hybrid model. Then we're able to ensure that we're seeing more people in more efficient and higher quality and patient-centered way.
Yeah, thank you. Have you any plans to build a bigger hospital? I know that this weather, severe weather showed us to be cut off. Is there plans to make it a better place, like a bigger, better hospital? And I got another question after. Sorry.
Yeah. No, thank you for the question. I think, I visited the Fraser Canyon Hospital when the waters were right at the edge of the parking lot, and have visited the services there. And again, acknowledging heroic efforts of the teams during the flooding and COVID times. And what we look at is, what's the kind of capacity issues, and what is there expansion that's required from capital, or is there expansion that's required human resources? And what we immediately saw was that there's more greater need for human resources. We've actually expanded human resources within Fraser Canyon Hospital to ensure that there's extended service capacity in terms of capital, actual expansion of infrastructure. I think we've made some amendments, but we haven't actually gone into rebuilding or infrastructure at this time. But of course, we also monitor that very closely. But certainly, currently, we've expanded quite a bit of clinical services in that current setting, and also, of course, took the opportunity of COVID to make any infrastructure updates that's required around the area, outside the hospital as well as inside the hospital.
Okay, thank you. And out of the 15,680 babies born in Fraser Health, how many were born at Hope?
Oh, you're really testing me. I don't think I can give you that.
The answer is 0.
Yeah.
We haven't had a baby delivered there in 20 some years. It's not a real hospital. Everything goes away from there. It's more like just a place you go and you get transferred from. Like, if you go to you get in a car accident, you go there and then you're taken somewhere else. We feel that we should be able to go there and be looked after. And the way that the traffic always seems to flow to the bigger cities, we think that if we had MRIs in Hope and like that, it'd be easier for Chilliwack to come to us, because the way the traffic flow is and all that. It just seems to be like a jewel that we're not really using. But thank you.
Thanks for sharing that as well. I mean, I think it's one of those areas that we talked about earlier about how much service can we provide in each of the hospitals and what's regionally shared. And part of the human health resource challenge is that, we have specialists and number of people that are trained in specific areas. Maternity services used to be much more, I think, embedded across. But now we're seeing increased, I think, complications because age of women that have babies also have increased, but also at the same time, more challenges of recruitment of pediatricians and all of those things. And all of those things to say, I think sometimes we focus on providing high quality care, and that might sometimes mean that that service is not in every community. But what's very important is that we network to ensure that those services are accessible as much as possible in a way that's, I think, patient-centered, and providing that high quality of care sometimes really means that we need to ensure that we have adequate number of people that can provide pediatric maternity services in that community. And that's part of the challenge sometimes of having each service in Fraser Canyon.
We'll take one more question from Director Facio.
Thank you, Madam Chair. Thank you, Dr. Lee. Nice to see that you're a real person. Much appreciated. And your team for their presentation this evening. On a positive note first, from several of my residents, not recently, but over time, they're very complimentary of the health they receive from our hospitals and Fraser Health. So it's there's a lot of good positive stuff out there. My question is, has there been a major catch up now on the surgeries? Now, hopefully things are quietening down a little bit.
Yeah.
Thank you.
Well, thank you so much. It's good to see you as well, Director Facio, in person instead of virtual. So yeah, we've actually made quite a dent in terms of catch up from COVID postponed surgeries. And I've got my expert here, Lori, so I'll ask her to speak to it. I'm really proud of the work that extraordinary efforts that were made, because we know that those postponements impacted every individual that were waiting to get their surgeries. And there were really extraordinary efforts made to catch up as quickly as possible. Really proud of that work. And in fact, if you compare from past years, we've increased over 100% in capacity of the surgical work that we've been doing, even during COVID years, even with the impacts that we had in Fraser Health that's disproportionately affected our region. But I'll ask Lori to provide more detailed information.
Yeah, sure. So surgery is one of my most favorite topics to talk about. But we had a plan pre-COVID to expand our services and do more surgeries in Fraser Health over our 1920 baseline. And what we were able to do despite COVID, and I'm so proud of this and our teams, is that we were able to expand our surgical performance almost 4% despite COVID. So we're one of the health authorities in the entire province that was able to do that. We kept most of our surgeries going. Yes, there were some that were taken down when we were during our big peaks of COVID patients in hospital, and we just couldn't manage it all and had to move our staff around. But overall, we had great success. And I would say on a percentage wise, we really didn't impact surgeries that much compared to other health authorities. So thanks for that question.
Thank you, Dr. Lee, and to your team for coming this evening and presenting to us and sharing information and answering questions so openly. And we look forward to working with you as very collaboratively in the future. And thanks again for your presentation, and look forward to seeing you soon again.
Thank you so much for the kind invitation. I'm really grateful for your ongoing partnerships, as well as also for the collaboration throughout the pandemic and ongoing. And I look forward to seeing you in person again. Have a great evening.
Thank you so much. Ms.
So,
Kinnaman?
thank you, Acting Chair Pranger. So we will now move to item 7.1, which is options for the election of the Fraser Valley Regional District Hospital Board Chair. And there are two options, motion for your consideration.
Madam Chair, I'd like to move option 1, Madam Chair.
Is there a seconder? Director Horn? Those in favor, contrary, carried.
Okay, Madam Chair. So since option 1 has been moved, that would mean that we now need to facilitate an election. So at this time, I would ask for a first call of nominations for chair of the Fraser Valley Regional Hospital District.
I'll nominate, Madam Chair, I'll nominate the acting chair as the chair. That would be you.
Thank you, Director Horn. Thank you. We don't actually need a seconder. I appreciate the enthusiasm. So Director Pranger, do you accept this nomination?
I do.
Are there any other nominations? I would just ask if staff could perhaps put the full gallery screen on Zoom so I can see all of the members. Thank you. So for a second time, are there any nominations for the position of chair for the Regional Hospital District? For a third and final time, are there any other nominations for the position of chair of the Regional Hospital District? Hearing none, I now close the nominations and declare that there will not be an election, and confirm that Director Pranger is elected chair of the Fraser Valley Regional Hospital District.
Thank you.
So at this time, I would ask that Director Pranger take the position of chair and chair the rest of the meeting. But if you would direct staff to facilitate the election of acting chair.
I will do that. Is there a nomination? Director Lowen?
Yes, thank you, Madam Chair. I would nominate Director Siemens as alternate.
Thank you.
So I can
Well,
actually do this for you, Chair Pranger. So Do you accept the nomination? Thank you, Director Siemens. Are there any other nominations for acting chair? For a second time, are there any other nominations for acting chair for the Regional Hospital District? And for a third and final time, are there any nominations for the position of acting chair of the Regional Hospital District? Hearing none, I now close the nominations and declare that there will not be an election and confirm that Director Siemens is elected acting chair of the Fraser Valley Regional Hospital District. So thank you all. So Chair Pranger, you do have an opportunity to provide remarks if you would like, or we can just continue on with the agenda.
I think we will carry on with the meeting.
Thank you. So item 7.2, we have Fraser Health Authority 2021-2022 capital funding request. There is a motion for your consideration.
So moved.
Director Facio, second Director Amundsen. Any discussion? Director Lum.
Thank you, Madam Chair. Very briefly, I had a conversation earlier on, just informally about this whole funding model with the Regional Hospital District and the kind of peculiar way that we fund hospitals. And even though we exist in Fraser Health, we have hospitals that exist within the Metro Vancouver area. And I had some questions that I couldn't answer readily. And so I'm wondering if we can have staff look into some of the questions that I was asking, in particular, this historical agreement that is laid out with the province of British Columbia and Metro Vancouver, is that in exchange for hospital capital dollars, they take over transit and TransLink dollars, and they also have the ability to levy a certain amount of gas taxes. And of course, as I was in Vancouver today buying gas, and I'm wondering, where is that money? Where is my money going? Is it contributing into TransLink, and how many people are doing the same in the Fraser Valley? And so it's a question that I think begs answering, and what happens with that differential? What happens? How are, let's say, citizens of Metro Vancouver who exist inside the Fraser Health boundary in Surrey, the second most populous city in the province now, how are they contributing to Fraser Health and paying for hospital services as well? And so those were questions that we didn't have ready answers for, but I would really like support in having staff look into and get some of those answers to work with Fraser Health and probably the province. It's more likely a question to the province about how that works and how they're ensuring equity to citizens, in particular in Fraser East, instead of getting kind of almost double dipped in terms of paying some of these additional taxes and also paying for all of the hospital or a portion of, I should say, a portion of those minor and major capital expenditures. So in a long-winded way of asking to refer a question to staff on the matter of healthcare spending and the historical inequity.
Through the chair to Director Lum, we would be happy to take that as staff direction. I would have suggested a motion, but I'm not sure we could have crafted one out of that. So we'll just, I understand the intention, and we will take it as, we'll take it as staff direction to bring back a report in that vein.
Very well. Thank you, Ms. Kinnaman.
That is still a necessary step aside from this motion that's on the floor. Director Horn.
Thank you, Madam Chair. And building on Director Lum's comments, again, this would probably fit into the category of further conversation we would ask to be undertaken by both staff and by our new chair and acting chair. Because in addition to the comments that Director Lum made, I think we need understanding of why there was such a difference in the capital request this year from Fraser Health and the amount we budgeted. And we know there's an issue around the fiscal year alignment for one thing. And at Capital Working Group, we had quite a few questions about what items were to be considered. I think it would behoove us to look at this as the first question before us, and we may end up hearing from them something that in staff's opinion and in the chair's opinions needs to come back for further consideration, as well as a new process for the future. So I would ask that we include that in the conversations that staff have with Fraser.
Thank you. Are you ready for, I'm sorry, Director Clute?
Thank you, Madam Chair. I guess this is through to staff. Is it just me or is this somewhat peculiar that they come forward at the 11th hour with such a significant request for an increase? You know, I can appreciate we are the fastest growing region of the country, and I can appreciate that our residents in our region come to expect the best care possible, but it's a significant increase, and I'm just curious how we got to this point.
Through the chair to Director Clute. Yes, it is a little bit unusual. Typically, the process would be that, as you know, the Regional Hospital District Board has to pass a provisional budget by December 31st of each year. Often we would have received some kind of indication from Fraser Health in the fall. I suspect due to the layering emergencies that happened in all of these organizations, that step was missed. And then further complicating the matter, the official request was put into Canada Post and arrived by mail on the exact day that we were approving the final budget. So unfortunately, it was just a communications problem, I believe. We have addressed it with Fraser Health staff and have come up with a strategy for this year. But further to that, I think that as was evidenced by this evening's presentation, I think there is a desire to have more ongoing and regular dialogue between our organizations, between this board and Fraser Health, so that we can have a little bit of a better understanding of where their organization stands and what their priorities are and what their recommended priorities are. And our hope is that for the next board term, following the general election this fall, that the new board will embark on some strategic planning so that this board also can put forth what it views to be its priorities for the communities in the Fraser Valley.
Thank you. Any further discussion? If not, I'll call the question. Those in favor, contrary, carried.
So moving down to item 8, which is reports from board directors.
Any reports? If not,
So then we'll just go to public question period for items relevant to the agenda. And if we could just turn things over to our corporate officer, Jamie Van Ness.
So we have not received any written questions with respect to the Hospital District Board agenda. We do have 2 members of the public with us tonight. This would be your opportunity to ask a question with respect to the Hospital District Board agenda. Do either one have a question? No? Okay. We do have 3 members of the public also on the line through Zoom, and this would be your opportunity once again to ask a question with respect to the Hospital District Board agenda. And just hit the raise hand function to indicate that you wish to ask a question. And it does not appear anyone has any questions, and we can move on to the next item.
Ms. Kinnaman,
Looking for a resolution to close the meeting.
move Director Facio, second Director Shahal. Those in favor, contrary, carried.
And we'll just go into recess and move over to the Fraser Valley Regional District Board meeting.
Thank you, Ms. Kinnaman, and good evening. I'd like to call the regular meeting of the Fraser Valley Regional District Board of Directors to order. The first item, please. It's actually the first item is my item. It's in memoriam, and as was most eloquently shared by Chair Pranger, and we lost Director Terry Raymond on April 7th after his long journey with cancer. I won't go too much further into the kind of things that Director Pranger already shared, but I do know, I just want to share that Director Raymond was a longtime resident of Boston Bar, and That's okay. He had a keen interest in the region's history and the people who lived there. He was very active with the Boston Bar and North Bend Enhancement Society as an FVRD director and a past chair of this organization. He was a champion of many, many projects, and most recently the purchase of a new property for the Boston Bar Volunteer Fire Department, and also the multi-million-dollar restoration of the historic 1914 CNR railway station house in Boston Bar. Terry was first elected to office back in November 1996, and he served on the FVRD board until 2008, where he took a short break and then was back re-elected in 2014. Obviously on behalf of the board, we're very, very saddened by the loss of Terry, and we'll feel his loss profoundly here at the board table. Personally, I always appreciated Terry's quick wit, his sense of humor, and it kind of balanced out how seriously he took his role advocating for the smaller rural areas in British Columbia, of which he was a true champion. I also realize that there are people around this table who served alongside Director Raymond much longer than I had the pleasure of doing so. I just wanted to take a quick opportunity to check in with the board and see if there's anybody who had something they wanted to share. And don't need to hog the mic here today, but Director Dickey.
Thank you, Mr. Chair. And I thought I'd just point out how important Director Raymond was at the electoral area level, not only within the regional district here, but he also represented all the electoral areas throughout the province for a number of years at UBCM, and watched Terry for a very long time at our committee level, and he was always a consummate gentleman. But he was also a fierce advocate for his community in Boston Bar. And I think back just a few months ago, I think it was just following the provincial election, and we were on a Zoom call with the new MLAs, and everyone was on their best behavior and trying to make a good impression. And suddenly Terry piped up. It appears that one of our residents has been attacked by an ostrich and has had his arm broken, and I am going to have to excuse myself. And off Terry went to get some health care for this gentleman. So that was Terry. He was a great friend, and he's going to be dearly missed.
Thank you, Director Dickey. And I don't see anyone else. And there's just one thing I don't know if staff wanted to share it, but we were kind of brainstorming ways that we could kind of celebrate Terry's legacy here at the regional district. And one of the ideas that we came up with, and I do want to give some credit to our staff who worked very closely alongside Director Raymond, and also got to speak to his family and some of his loved ones. And then we were looking at the opportunity to name the Hope and Area Recreation Bursary in honor of Director Raymond. That was an idea, and it was something that he was very passionate about. And I'm looking for the board's support in this motion, this endeavor.
Second.
Moved by Director Popov, seconded by Director Facio. And any other comments or questions on this? Seeing none, I'll call the question. All in favor? Opposed, if any? The item carries. And then one final thing before we continue our program that Director Raymond would want everybody to know, and that is, it is 241 days until Christmas. Okay. Next item, Ms. Kinnaman.
Looking for approval of the agenda, addenda, and late items.
So moved.
Thank you. It's moved by Director Facio, seconded by Director Blue. All in favor? Opposed, if any? Item carries. Next item.
4.1, we have a delegation from Fraser Basin Council.
Thank you. And I see a number of delegates from the Fraser Basin Council, and I'll turn it over to them. Is it Mr. Marshall that's going to begin, or Mr. Purdy?
Yeah, thank you, Chair Lum. It's David Marshall. I'll lead off. First of all, I want to thank you for the opportunity to be with you this evening. We'd love to be there in person, and hopefully the next time we will be. I'm coming to you from the unceded and traditional territories of the Coast Salish people. It's wonderful to hear the tributes by you, Chair Lum, and others with respect to Terry Raymond. Terry was a longtime colleague and a friend of the Fraser Basin Council. He sat on the board of directors representing the Fraser Valley Regional District on a couple of occasions, and we will miss him. He was a true friend and colleague and very strong advocate for sustainability. This year is our 25th anniversary. It's hard to believe that we were formed in June of 1997. And one of our very first partners was the Fraser Valley Regional District. We valued this relationship with the regional district, with the directors and staff over the years, and tackling many sustainability projects and initiatives in the Valley. And we look forward to that continuation. I'd also like to acknowledge you, Chair Lum, and Director Dixon for sitting on the Leadership Committee of the Lower Mainland Flood Management Strategy, as well as Director Dixon representing the Fraser Valley Regional District on our board at the present time. I'm going to turn it over to Bob now, who will take you through a more substantive presentation. Over to you, Bob.
Great. Thank you very much, David, and good evening. Indeed, I share your grief about Terry Raymond. I considered him a friend and just a wonderful human being. So indeed saddened like you are with his passing. I'm joining you from the traditional unceded ancestral territories of the Coast Salish people here in North Vancouver, and really pleased to have the opportunity to just briefly run through a few updates of relevance to the regional district, and hopefully at the discretion of the chair, if there's time for questions, we'll be happy to entertain them. Obviously, the events of last November cast a spotlight on the critical need for major investments in flood mitigation, well beyond what typically has been offered in funding in recent years. And we recognize that that funding has been needed for quite some time now, and we appreciate your advocacy around that topic. But having said that, the agencies that we're working with within the provincial and federal governments, for example, they literally need to talk about numbers in the billions potentially over a long time scale. And they demand, of course, sound information analyses before making those meaningful commitments. And that's a lot of the work we have been doing, recognizing that's being done within the context of a very high state of urgency. But I should note that many of the tools and supports that we've provided are available for use now. And while they are setting the stage for the business case for those major investments, there are examples where these tools are very helpful to the regional district, but specifically to municipalities. We've developed a Lower Fraser flood model that simulates a variety of different river and coastal flood scenarios, potential dike breaches, and the effects of various mitigation actions. We've modeled some 24 scenarios to date, and we understand that the flood model and the maps are used by 16 local governments and perhaps more, as well as several other organizations, to do their own sort of gaming and decision support as we speak. Secondly, we have developed an extensive website, floodwise.ca, which really is a single portal website that provides a very rich set of information around flood hazards, risk, and mitigation actions. And I should note that this website is also a great tool for the education of the public. And we really appreciate the fact that several of our local government partners at the staff level have directed public inquiries to that site for further information. And as you all know, it's really important for the public to have easy access to such information because ultimately they need to be behind those decisions that need to be made for major investments. The resources, in addition to what I've described, you can read yourself, but certainly these are all at the ready now for decision support at the municipal and regional district level, as well as by other partners. So one of the reasons we wanted to come up and appear as a delegation sooner than today, but we did need to negotiate with the provincial funders of our work and federal funders what's next. And hearing the call to action, I'm pleased to say that the work we've got scoped out in the near term is really focusing on the action piece. First of all, harnessing the tools that we've developed through the Lower Mainland strategy, and specifically over the next short while, we're comparing various return period flood levels with dike elevations to identify where the critical low spots are in the region. While low spots are possibly good candidates for mitigation, not all low spots are. So in addition to that work, we're overlaying additional flood scenarios, dike failures, and risk and consequence information to identify priorities for investment. And we really are committed, and with you as well, to share these results widely with all orders of government, again, with an idea towards catalyzing that early action. There are some important items that still need to be resolved through continued engagement of our local government partners, the provincial partners, federal and First Nations governments. These are, we wish they would be easy issues to resolve, but there is a fairly diverse range of perspectives on the direction on these issues, and we are going to continue to engage with an eye towards, if we can't reach 100% consensus on the direction here, at the very least identify where we do agree, where there is strong agreement, and where there might be some tough decisions made by the authorities to go in one direction or the other. And we do indeed look forward to continually engaging you and others to try to wrestle these to the ground, so to speak, and get to the action that you all desire. The final point there on the slide is around the fact that there are multiple initiatives underway at different scales, and we also see it as a priority to ensure that wherever possible, we align the work of these initiatives to avoid duplication and to increase efficiency. My colleague Steve Litke is on the call. He's the program manager of the Lower Mainland Flood Management Strategy, among other duties, and he'd be happy to address specific technical and other questions related to the strategy. Moving right along, I just wanted to mention Salmon Safe, which is really on a trajectory in terms of interest from our local government partners, from developers, First Nations and others. It's a very robust eco-certification program for both urban and agricultural sites. We just recently reconfirmed or recertified Vancouver Airport as the first airport in the world to achieve Salmon Safe certification. And we're looking forward to growing our certified sites here in the Valley for both urban and agricultural certification standards. We've got 3 here in the Valley. We'd like to see that number grow. It's a great mechanism for a robust way of managing water at the site level, but it's also a good way to increase the efficiency of the dealings between municipalities and developers. Plug-in BC continues to grow as a sort of one-stop shop for incentives for both reaching consumers or potential buyers of electric vehicles and also building out the charging infrastructure. I urge all of you who are interested in the various incentive programs to visit pluginbc.ca. I should mention that the Emotive Community Outreach Incentive Program is now accepting new applications for provincial funding to support EV outreach and education. It's open to local governments, First Nations, businesses, and NGOs. You're invited to apply for the funding for, say, an EV test drive event or vehicle demonstration, webinar, or educational session. And again, the application information is on the website, pluginbc.ca. Sorry, I didn't quite say that right earlier, but the applications are open until May 25th. And there's been strong update in the Valley with these programs. For example, fast chargers were supported for the city of Chilliwack, for the Lacamo First Nations, Paz Fuels in Abbotsford, and the Chevron Station in Hope. And we're looking towards support for electrical upgrades and charging infrastructure at the city of Abbotsford. With this new era of the UN Declaration of the Rights of Indigenous Peoples being embraced by Canada and BC, and the passage of the DRIPA legislation and the recent release of the DRIPA action plan here in BC, there's a tremendous opportunity to share knowledge about what's working well in terms of building strong trust-based relationships between Indigenous and non-Indigenous peoples. And we are actively, through our Realizing UNDRIP program, focusing on knowledge around building strong Indigenous local government relationships, and looking forward to sharing this knowledge through learning events and also doing our work in a way that links with complementary initiatives to avoid redundancy. Cultus Lake, we continue to support the work on Cultus Lake. The photos you see actually are of some of the damage that was incurred by Cultus and environs as a consequence of the floods. But the issue around the lake continues to be deposition of nutrients, many of which come from atmospheric sources. And this is not just a Cultus Lake issue. Eutrophication is a challenge faced by several water bodies in the region. There is a continued need for enhanced regional scale collaboration on this issue. And we welcome your suggestions around how we and who we should engage around that regional scale collaboration to deal with this pressing issue of eutrophication. Illegal dumping, here the photo is from a place you all well know near Gill Road. This is an ongoing and difficult challenge, very costly to the environment and to public funding. We continue to support the Fraser Valley Illegal Dumping Alliance. And we are initiating some work with some of your staff to document the nature and extent of this issue with an eye towards building a case for enhanced provincial government engagement in this issue. And as you know, it's an opportunity to highlight the root causes of this issue, for example, poverty and homelessness, which don't belong solely in the domain or the mandates of local government, as you well know. So in conclusion, I just wanted to reaffirm or restate what David has said earlier. We really do value your financial contribution towards the FBC since our inception in 1997. Our strategy always has been and continues to be to leverage your contribution to bring significant contributions on other fronts to the region, like our EV incentive programs. And we do see our work continuously evolving, and we see new opportunities to further leverage our work together, and we welcome your suggestions in that regard. So thank you for your attention. Thank you for the opportunity. Thank you for your support. And over to Chair Lum at your discretion if you have time. If there's interest, we'd happy to field any questions. Thank you.
Thank you, Mr. Marshall and Mr. Purdy. Any questions from directors? Director Siemens, go ahead.
Thank you. Through the atmospheric river events, we noticed a lot of sediment coming down and deposited much more than what we've had in the past. So I'm just wondering, the removal of that sediment, primarily from the Fraser, which I think this freshet could have some challenges. That sediment is caused a number of challenges with erosion arcs and those types of things. So just wondering what are your thoughts on the removal of that sediment, and what would those steps take? Because I think that's a significant issue on the Fraser, but also on the Vedder, the Sumas, and I'm just not sure, how do we get that conversation going, or is it ongoing?
Understood.
Steve,
yes.
Question or Bob Purdy?
Yeah, I think it's a great question. It's a topic of great interest in the region here. I will defer to Steve. He's certainly looked at the removal side as one of several actions that could be taken. But Steve, you have the floor if you can. Thanks.
Yeah, thanks, Bob, and thanks for the question. It's definitely come up in a number of conversations with the province, in addition to the Fraser tremendous with those extreme flows that were experienced in the Tulameen, the Coldwater, the Nicola, tremendous amount of erosion and downstream deposition. So that managing that debris, that sediment, definitely something that the province is concerned about and looking at. I think I don't have an answer in terms of what the steps are. I think it should be looked at in each of the local contexts and to try to better understand the impacts that that might have on existing erosion and also flood levels. And then, of course, the other challenge, and it's been an ongoing challenge, is the regulatory approvals of that. So I'll commit to follow up with the regulators and try to get a better answer for you in terms of how the province is looking at this.
Fair to say, though, Steve, that any of the LMFMS work doesn't preclude sediment removal in some of the options that may be presented to the provincial and federal government.
That's right. Sediment management was approached in a couple of different ways. One was the recommendation in draft one of the strategy was to update the information to develop a sediment management budget and a sediment management plan over the long term. The other way it was looked at is under the modeling scenarios, 6 different mitigation measures were simulated within the flood model. One of those was sediment removal in the gravel reach. So essentially removing 2 million cubic meters of sediment, essentially lowering the tops of gravel bars by about 2 meters between the Rosedale Legacy Bridge and the confluence with the Harrison. And the modeled effect of that really significant removal was to lower water levels by about 15 centimeters within that reach of the river. So we've got some tools to better understand it at a local and a regional scale. That said, we don't currently know what the riverbed looks like in terms of post atmospheric rivers in November.
Thank you. Director Bales.
I was at your forum on the Calgary River, and you were talking about how the floodways were going to be opened up, and I wondered how that's going.
I'm sorry, don't understand the question.
At the Calgary forum years ago, you were talking about how the floodways were going to.
Oh, we lost Director Bales there.
Oh,
Unit.
I just, oh yeah. At the Calgary forum, you were talking about how you're going to open up the floodways and that would help with the floods. And I just wondered if that helped at all.
Yeah, I'm sorry, Director Bales. I don't recall the conversation. There's a number, I'm not even sure if those were new structures that were proposed. I know they were looking at a number of different dams and reservoirs. My apologies, I don't recall that.
Yeah, no problem.
Thank you, Director Bales. Director Davidson.
Thank you, Chair. So sedimentation is a major concern in the Hatzic watershed as well. And earlier you were speaking to water models that basically, I'm assuming, do various what if flood scenario modeling. Are you getting into that sort of level of granularity where you can model allowing for unmitigated sedimentation versus mitigated sedimentation? The context for my question is one is that in the Hatzic watershed, essentially we have decades of unmitigated sedimentation, and getting it looked at by any layer, any level of government is a challenge. And I'm thinking in terms of, hard data, hard models, or something that can drive action by basically showing, well, if you were to mitigate sedimentation and lower take like a foot or two out of your main water channels, then this would be the impact of your floods, or your risk profile would improve. So I'm kind of just asking you a techie question, if you have that level of granularity allowing for sedimentation and unmitigated sedimentation in any of your flood models? Thank you.
Yeah, so for the lower Fraser model, it was, I guess there's a couple ways of looking at it. What it does is it for a given flow on the Fraser and a given downstream ocean level, it will generate what water levels would be experienced. And a key input to that is what's the geometry of the riverbed, any gravel bars and islands. And I think the challenge is that that changes from year to year. So when the bathymetric data was collected in 2017, we've had a number of high flow years since that time. We've had additional sediment accumulated since that time, and that's in the Fraser. So there's a need to update that information. And then I think it's even more challenging on some of the smaller systems, tributary rivers and streams, where the risk is more localized. It's more challenging to fund that kind of analysis. So I think it has been undertaken for some smaller systems. I suspect on the Chilliwack Better, well, for sure, that would be part of the Better River Management Plan. I'm aware of some studies on the Coquihalla. I'm not aware of the latest on the Hatzic.
Quick follow-up, Chair.
Go ahead.
So what's the process for getting a follow-up on the Hatzic? How do we get that to happen?
There may be some opportunity through the Community Emergency Preparedness Fund. I know that eligible projects are around flood assessment, flood planning, that there may be an opportunity to have a targeted project to take a look at the sort of current hydrology and sediment dynamics in the Hatzic.
Okay, thank you.
Thank you. I see Director Pranger and then Director Horn.
Thank you. Through the chair to our guests. As the Fraser deposits more and more gravel in the reach, we are as a community suffering more from more erosion than we ever did. As it builds, it changes the course of the river and it heads to the banks. And as it heads to the banks, it gets closer and closer to our dikes. So the question I have is, will you advocate for us for gravel removal and to work with us to do some preventative and proactive measures to in all events, try to avoid another disaster?
I think the role that Fraser Basin Council could play would be to support that advocacy with some analysis around the sediment dynamics and to promote that kind of a longer term sediment management plan. There's so much I guess contradictory science there in terms of the limitations of the effects of sediment removal on affecting river levels. That there's not the evidence that would be a significant, it might be part of the solution and it might have some more significant localized benefits if there's certain areas that are sort of choke points. But we were not in a position to advocate for that. And actually, it was recommended early in this process that the flood strategy shouldn't be prescribing who should do what where. It was more about providing the support for communities to propose flood risk reduction measures.
I think what you're hearing, Mr. Litke, is that we don't want some of those solutions to be purposely left off the list. We realize that it's not a one size fits all or a magic bullet solution, but there was some concern looking at the direction of the provincial government where no sediment removal has occurred in the past while, that perhaps they were moving completely away of even looking or considering that as an option. And I think we've even heard it from some Indigenous communities that were involved in some sediment removal, that it may be one of the tools in the toolkit that we consider. And I think, what this board wants to hear is that we wouldn't
we wouldn't necessarily leave that off the list. And I think what I'm hearing from you is that, no, we wouldn't leave it off the list. It would be one on the list, and it would be up to our local communities to really help bring that forward to the provincial government to help advocate for that, is to be one of the solutions. I know there's a fairly successful program that you mentioned on the Vetter, that has semi-regular removal, sediment removal as part of the solution. In addition, we've got some wetland restoration projects, as well as some diking infrastructure. So it may factor in as one in a suite of flood infrastructure projects that we consider. Director Horn.
Yeah, if I could, I'm sorry to interrupt, but I would say everything needs to be on the list. The nature and the complexity and the challenge at hand, you're quite right. There is no single silver bullet. So probably for most communities, multiple measures are going to be required to work in a complementary way.
And I think in reference to Director Pranger's second question, absolutely, Director Pranger, we want to work with all communities on all the different options.
Director Horn.
Thank you. Well, I didn't originally put my hand up for this matter. I'll get to the one I raised my hand for in a second, but speaking further to Director Pranger and Chair Lum, I think one of the things that we need to do here is activate this idea. And that's kind of the undertone I'm hearing. It's been caught up in rhetoric for many years. Is dredging and removal of material a good thing or a bad thing? And so my question is, what does this group need to do? What does this board need to do to specifically ask for the clarity or the evidence we might use from Fraser Basin Council when it comes to this? And the rationale for that question is, I've heard the message that it's one of the tools in the toolkit, but it strikes me that it's one of the ones that's more easily implemented. Whereas talking about building dikes is highly costly, here we'll find partners who are ready to do the work because it will likely produce revenue. So it's low-hanging fruit. So my question before I go on to my second one to the chair is, what do we need to do in terms of making a formal request to ask for some kind of data or evidence that will help us in advocating for this approach?
Yeah, I suppose while we looked at it, and by we, I mean the Lower Mainland Flood Strategy process, looked at 6 flood mitigation scenarios. I think as we refine our understanding, the more complex scenarios that would implement or simulate multiple measures, dike raising, sediment removal, dike realignment, those kinds of things, to see if those in combination can make a bigger impact in terms of lowering flood levels. I think there might be some specific studies in terms of updating the bathymetry of the Fraser, so we have a more current understanding about where the gravel is accumulating and where it's eroding and degrading. I think the other thing is a lot of the sort of hesitation on the regulatory side has been with respect to concerns around environmental impacts, especially around fish and fish habitat and endangered aquatic species. So a better understanding if there's some ways that sediment could be removed that would maybe mimic natural river processes and would be less likely to impact on aquatic ecosystems. And then, of course, going back to Bob's point about the United Nations Declaration, I think First Nations title and rights and interests as it relates to sediment removal and the potential benefits and potential adverse impacts would be another important consideration.
I'll set that on the table for now. I think there's more work for us to be doing around this table in terms of what we would ask and who we would ask. The question I wanted to ask initially was, I was very happy when I first saw in your presentation the floodwise.ca website. Went there hoping that it would offer real clarity in terms of river forecasting and flood mapping. But I see that there's a link through to the River Forecast Center's own links. And I have to say, I find their tools incredibly complex and not very user-friendly. I don't know whether to look up the coffee system or the Warren system or all of the different systems that are really quite technical. My question is, does the Fraser Basin Council anticipate as that website develops, creating more user-friendly tools that are directly embedded into the website?
Yes, yeah, and we're very open to suggestions on that. So for example, some of the maps that have been developed through the flood model, they're kind of static maps. One of the things we've been discussing is something more interactive where the user could select the scenario they wanted um, and sort of zoom in to areas of particular interest. Definitely, we're looking for where there are existing initiatives and tools and resources that are available, and we're looking to update some of that. I'm not sure what the plans are at the River Forecast Center, but I know that that was one of the items where there are some additional resources dedicated in the latest provincial budget. So that's something that's, I think, under consideration is their forecast capability. I don't know if part of that is improving on the accessibility and the presentation of that information on the website. I think a key thing is when there is an elevated risk during freshet, that they shift from those hydrological models that predict flows to a hydraulic model, which will actually tell communities what water levels can be expected in relation to those flows. And that's when we're sort of in the middle of that sort of pre-freshet preparedness and response stage.
Thank you very much. Speaking in support of that, I think we saw during the atmospheric river events that people just didn't know where to get the information reliably, and in many cases went without it or called staff that were otherwise trying to literally address the issue. So the more we can put that in the hands of people, the better. But thank you very much.
That may be something that the leadership committee considers, in terms of asking or bringing up as a concern raised by local government as well. Put a pin in that one. Director Facio.
Thank you, Mr. Chairman. Just like to bring up that I think it was 2 weeks ago that the local mayors, I believe, included Abbey, Hope, Chilliwack, Kent, Hot Springs, and I think FVID as well. We're on a call with our minister and EMBC regarding the flooding, and it was a very good session that we had in regards to what we're speaking about now. And they will be coming back to us with a report on what Director just mentioned in regards to getting more information out there to the folks. But it was also the C2C Let's Smart Committee also sent a letter as well to the province regarding the areas of concerns like Director Pranger brought up in regards to the Kent area, and of course the other areas with the First Nations, of the erosion that is happening. So there was a very good meeting following. I believe FVID was on that as well. Am I correct, Mr. Chairman?
We were,
and I'm sure that information will come forward from that meeting, and that can be flowed through to the directors here as well. Thank you.
Thank you, Director Facio. And I know you were a key part of that meeting and raising some of the concerns directly to Minister Blair and Minister Farnworth, and appreciate that. I'm glad you referenced, and as did Mr. Purdy, the kind of parallel process that's happening right now with the EPS and really being driven by Indigenous communities. And I think that's incredibly important because it is important to recognize that there are some unique challenges that are being experienced by Indigenous communities when it comes to flooding, flood infrastructure, and the ability to pay for it. And completely, it's very good to hear that the Fraser Basin intends to support that, but also understands that what that's given us is a unique opportunity to kind of work on the LMFMS to focus on prioritizing areas important to local government. And I think it really kind of refocuses some of the challenge, which is to fit our processes together, make sure there's not overlap and duplication, as you said, but also really ensure that we're representing the interests of local government at the table. And I really look forward to undertaking some of that work. I don't see any other questions. So thank you, gentlemen, for your presentation tonight. It's very good, and glad to see you all, and hopefully see you in person next time.
That's right. Well, thank you again. Very much appreciated, Chair Lam.
Thank you. Good evening.
Ms. Kinnaman, next item.
Thank you. 5.1 is the draft Fraser Valley Regional District Board meeting minutes of March 17th, 2022.
Thank you. It's moved by Director Adamson, seconded by Director Clute. All in favor, opposed if any, item carries. Next item.
Item 6 are information minutes and matters arising. Happy to separate any of those items out.
Thank you. Any questions on any of the items? Don't see any. Next item.
7.1 is the election staff remuneration rates for the 2022 general local elections.
Thank you. Motion for consideration.
So moved.
Moved by Director Hamilton, seconded by Director Facio. Discussion. Hearing none. All in favor. Opposed if any, the item carries. Next item.
8.1, we have a 2022 grant and aid request for the Cultus Lake Stewardship Society in electoral area H.
Thank you. That's moved by Director Dixon, seconded by Director Popov. Discussion. Hearing none. All in favor. Opposed if any, item carries. Next item.
8.2 is another grant and aid request for the Dudney Elementary School PAC in electoral area G.
Thank you. It's moved by Director Stobart, seconded by Director Adamson. Discussion. Hearing none. All in favor. Opposed if any, item carries. Next item.
8.3, 2022 grant and aid request for the Boston Bar Community Charities Association in electoral area A.
Thank you. It's moved by Director Johnson, seconded by Director Adamson. Discussion. Hearing none. All in favor. Opposed if any, the item carries. Next item.
8.4 is a grant and aid request for the Actively Creating an Exceptional Society in electoral area C.
Thank you. That's moved by Director Bales, seconded by Director Stobart. Any discussion? Hearing none. All in favor. Opposed if any, item carries. Next item.
8.5, we have the Community Works Funds reallocation options. There's a motion for your consideration.
Thank you. This is for EAs. Do you have a mover and a seconder? It's moved by Director Davidson, seconded by Director Angar. Discussion. We're good. All in favor. Opposed if any, the item carries. Next item.
9.1, we have the Fraser Valley Regional District Directors Remuneration Amendment Bylaw number 1662.
Thank you. Looks like we've got 3 motions on that. So motion number 1, it's moved by Director Horn, seconded by Director Dixon. Discussion. Hearing none. All in favor. Opposed if any, item carries. Motion number 2, it's moved by Director Facio, seconded by Director Dickey. Discussion. Hearing none. All in favor. Opposed if any, item carries. And motion number 3, it's moved by Director Popov, seconded by Director Pranger. All in favor. Opposed if any, the item carries. Next item.
Thank you, Mr. Chair. So item 9.2 is the Fraser Valley Regional District Electoral Area D Zoning Amendment Bylaw number 1632.
Thank you. It's moved by Director Dickey, seconded by Director Dixon. Discussion. Hearing none. All in favor. Opposed if any, item carries. Next item.
9.3 is the Fraser Valley Regional District Security Issuing Bylaw number 1655.
Thank you. Again, 3 motions on this item. Motion number 1 is moved by Director Adamson, seconded by Director Stobart. Discussion. Hearing none. All in favor. Opposed if any, item carries. Motion number 2 is moved by Director Clute, seconded by Director Hamilton. Discussion. Hearing none. All in favor. Opposed if any, item carries. Motion number 3 is moved by Director Horn, seconded by Director Facio. Discussion. Hearing none. All in favor. Opposed if any, the item carries. Next item.
9.4, we have the Fraser Valley Regional District Vetter River Campground Fees and Other Charges Amendment Bylaw number 1660.
Thank you. Another 3 motions. This is for all except Abbotsford, who's not a participant in this particular vote. It's moved by Director Hamilton, seconded by Director Pranger. Discussion. Hearing none. All in favor. Opposed if any, item carries. Motion number 2 is moved by Director Popov, seconded by Director Dickey. Discussion. Hearing none. All in favor. Opposed if any, item carries. And motion number 3 is moved by Director Clute, seconded by Director Stobart. Still no discussion. All in favor. Opposed if any, item carries. Next item.
9.5, we have the Fraser Valley Regional District Zoning Bylaw number 1638.
Thank you. This is for EAs. It's moved by Director Dickey, seconded by Director Adamson. Discussion. Hearing none. All in favor. Opposed if any, the item carries. It's a big chunk of work there by staff. Really appreciate that work. Next item.
9.6 is zoning amendment application for 10708 Farms Road in electoral area F to allow a cannabis production facility.
Thank you. This is EA's again. It's moved by Director Davidson and seconded by Director Adamson. Discussion.
Davidson,
Go ahead, Director Davidson.
just say support the motion. It should definitely move to public hearing once the technical pre-work is done. Thank you, Mr. Chair.
Thank you, Director. Any other comments or questions on the item? Hearing none, ready for the question. All in favor? Opposed, if any? The item carries. Next item.
Moving down to section 10 is permits, and I believe you have a script in front of you.
I do. Pursuant to Part 14, Division 9 of the Local Government Act, this is the opportunity for the FURD Board to hear from the public regarding the 3 development variance permits and 1 temporary use permit listed on the agenda for this meeting. Anyone who believes that their interests are affected by the proposed applications will be given an opportunity to speak. If you have any verbal comments with respect to the permit and you're joining us by Zoom on a computer or a smart device, I'd ask you please press the raise hand function. When it's your turn to speak, you'll be asked to unmute yourself. If you're joining us on Zoom by phone, please press *9 and this will notify staff that you wish to speak. When you're prompted to unmute yourself, please press *6. Those of you wishing to speak are asked to begin your presentation by providing your name and address, which will be recorded and form part of the official record. Please limit your comments to 5 minutes and confine your remarks to the application at hand. Ms. Kinnaman, item 10.1.
Thank you. So 10.1 is development variance permit 2022-02 to reduce side setbacks at lot 50-46484 Chilliwack Lake Road in electoral area E. And I would just remind the board that 4 letters were circulated by emails this afternoon.
Thank you. And now would be the opportunity for the public, anyone who wishes to speak to this item. We do have a couple of members of the public in the gallery. I'll just check in with them first. If they'd wish to speak to this item, they don't. Ms. Van Ness, do we have anyone joining us online?
We do have 3 members of the public on Zoom, and so this would be your opportunity. Hit the raise hand function to indicate you wish to speak to this item. And there does not appear to be any questions.
Okay, so this is for EAs. What's the board's wishes?
Yes, Chair, if I may.
Yes, go ahead, Director Engar.
Yeah, I'd like to refer this back to staff. A number of letters have come in sharing some concerns since we spoke about this initially at East. And I'm hoping that staff can find some solutions to the concerns raised. So I've spoken with staff and they do have the time to accommodate that need. And I appreciate and thank them in advance for doing that.
Okay, is there a seconder referral? Seconded by Director Gibson. All in favor? Those if any, the item is referred. Next item.
10.2 is development variance permit 2022-03 for 10356 Royalwood Boulevard in electoral area D.
Thank you. And again, I'll just check in with our members of the public. If you'd like to speak to this item. This is Royalwood Boulevard. Nope. And Ms. Van Ness online.
So for people joining us online, this is your opportunity to hit that raise hand function. If you wish to ask a question or provide a statement with respect to this item. And there does not appear to be any.
Okay, this is EAs again. That's moved by Director Dickey, seconded by Director Adamson. Any discussion on the item? Hearing none, all in favor, opposed if any, item carries. Next item.
10.3 is development variance permit 2022-04 to reduce the exterior side lot line setback for the construction of an addition to an existing dwelling at 43906 Eric Place Road in electoral area C. And again, 1 letter of concern was received and distributed by email and is on the table this evening.
Thank you. And for members of the public, just check in. Would you like to speak to 43906 Eric Place Road, electoral area C? Nope. And Ms. Van Ness online.
And just checking in with the 3 members of the public to see if they have any questions or have a statement and to hit the raise hand function. And we can move on.
Thank you. And board directors, what is your wishes? Director Bales?
The fire department in Moti had no problem with it, and the person that was concerned is no longer concerned.
Okay, so you wish to move the staff recommendation?
Yeah.
Director Dales? Great. Is there a seconder? Seconded by Director Adamson. Any further discussion? Hearing none, all in favor, opposed if any, the item carries. Next item.
10.4 is temporary use permit application at 57951 Laidlaw Road in Electoral Area B for pipeline construction storage.
Thank you. And members of the public wish to speak to this item? No, we're just so, you'll have to excuse us. We're just so excited about actually having members of the public here. Apparently you don't want to speak to any of the items. There's just nothing good on TV tonight. So thank you for joining us. So appreciate it. And Ms. Van Ness online.
Just checking in with our members of the public to see if there's any comments with respect to this item, to hit the raise hand function. And there's no questions or comments.
Thank you. And what's the board's wishes? Director Adamson?
I'm going to speak against this. So I'll move it to speak against it.
Okay, so
Can you
you'd
do
like
it?
to move the recommendation, get it on the table, seconded by Director Dickey, and I'll recognize Director Adamson.
Thank you. The reason I'm speaking out against this temporary use permit is I don't believe that the company has been a good neighbor, and we do have a good neighbor policy. I think we had staff put together an open house last fall to visit this pipe yard permit application, and all the concerns came out of the meeting, which was the strangest meeting I ever was at. Staff will vouch for it. We held it in the rain in the parking lot of the Legion because half the people showed up weren't vaccinated, so they couldn't come inside. So actually the meeting turned outside in the rain. There was a lot of complaints about the company's man camp that they have in Laidlaw right now, and the fact that there was not much input, there was no input into putting it in. It was, let me just back up. When Trans Mountain was a private company and they wanted to put a pipe yard in Laidlaw, there was great concern because they wanted to put it on St. Elmo's Road, which had 2 right angle turns to get in and only one way into the area and back out. It was going to go in the back of a farmer's field, and what they're going to do is take off all the soil, put down gravel, bring in 350 people and pipe yard for the length of time to do this. And the public was not impressed. So we had a meeting with the company, and I actually made the decision, I made the suggestion that they put the pipe yard where it is now, because it's right off the highway, right in and off, wouldn't bother the people. And the people all agreed, and the company agreed, and life went good, right? Where everything's good. So then fast forward, they're going to put in a camp for their workers. And this is at the east end of Laidlaw, all within about 1 kilometer. And the public had no input on that whatsoever because of the way that it went down. The local band Shahamel, it's on reserve, so they were building this. But when we asked the company, they said, well, we have no contract with them. They're doing that on spec. Sure, maybe down the road, we might rent it off them, but we have no deal. They're doing that all on their own. The fact, that nobody believed that they were just doing it on their own. It made it so there was no input put into the reserve because there was no help from the company to make that happen. And so it was built with no buffer to the neighbor and different situations, different problems like that. So those were the concerns that were mentioned at the open house. And as far as I know, they haven't done anything to address those problems. from me talking to the people. Instead, what happens is if you complain too much, you get put on the list of complainers and they just, you're one of them. Whether or not they're legitimate complaints or not, they just put the complainers into that list.
Director Dickey, I'm going to ask you to wrap your comments up here.
Yeah, I'm coming.
Thank you.
Coming to it. Yeah, thank you. Thank you. Yeah, I cannot support this reapplication. And I hope that you guys side with me. Thanks.
Thank you, Director Adamson. Any other comments? Director Dickey.
Thank you, Mr. Chair, and I salute Director Adamson and his advocacy for his community. The subject of this temporary use permit is a pipeline storage area, which, according to the staff, has been well coordinated and procedurally, all our procedures have been respected. I understand that there are many concerns elsewhere in the community, but I think we should really focus on procedure here and ensure that we narrow our discussion to the pipeline storage area. And from everything I hear, it has been well operated, and they've worked with our staff in ensuring that it's gone through the proper procedures. So I would support the staff recommendation on awarding the extension of this temporary use permit.
Thank you, Director Dickey. And I'll just check in. This is for electoral area directors. I'll just check in for a first time if anyone has any additional comments. And then go ahead, Director Davidson. Yep.
Thank you, Chair. So temporary use permits, to my knowledge, are discretionary permits, meaning that it wouldn't make it this far unless they had followed procedure, but it's the things that go beyond procedure that make these kinds of permits discretionary. And things like, are they good community citizens, are part of that discussion. And I think for that reason, I will be supporting Director Adamson and voting against this. Thank you.
Thank you, Director Dickey. Director Dixon.
Thank you, Mr. Chair. I'm just wondering if there's if possible to have the staff weigh in a little bit on this. I mean, I understand it is for pipe storage, and I'm hearing Director Adamson saying the neighbors are that part of what's happening is that they're not being good neighbors. Are they going above and beyond what they're allowed to do when they have set up a camp there, or is that way too out of this question?
Ms. Kinnaman.
Thank you, Chair Lum. Perhaps Graham Danilus would like to speak to this item.
Mr. Danilus.
Thank you, Chair Lum, through to Director Dixon. The subject of the temporary use permit is only the pipe storage yard. They recognize, of course, that Trans Mountain's activities in Laidlaw go well beyond the pipe storage yard. There's the Omahill camp that Director Adamson mentioned that houses 350 or so people, and of course the construction activities. The camp and the construction activities are under federal jurisdiction and have been approved, and the matter in front of the board is solely the pipe storage yard. Our staff experience of the pipe storage yard is that it's a professionally run industrial site, and Trans Mountain's work to address the concerns that came up at the May board meeting around contaminated soils. And the staff recommendation is to issue the permit. I might mention to the board that that interprovincial pipelines are a matter of federal jurisdiction. And insofar as local government bylaws and rules would impede the project, the local government bylaws are of no effect. And so Trans Mountain's not obliged to, I believe, to conform to the local bylaws. However, it's a condition of the pipeline approval from the Canada Energy Regulator that Trans Mountain would apply for and obtain local approvals. And so that's a rather indirect authority. If the approval is not forthcoming, I believe Trans Mountain can make their best efforts and appeal to the Canada Energy Regulator to forego the local government approval. And if that's the result, then the pipe yard, refusing the permit for the pipe storage yard might not mean that the pipe storage yard is discontinued. And in fact, if that turns out to be the case, having not issued the permit, I believe would put us in an even weaker position to work with Trans Mountain and the community to mitigate any impacts. We wouldn't hold a security. If the permit's issued, we will hold a security in the amount of $225,000. We would have the permit conditions that we could enforce, and furthermore, we'd have a relationship, a regulatory relationship with Trans Mountain. So failing to approve the permit might well put the regional district in a weaker position to protect the community than issuing the permit. But that said, I recognize there are much larger issues at play. And even though our experience with the pipe storage yard has been, I think, a relatively good one, and over about 4 public input sessions, there have been very little public comment specifically relating to the pipe storage yard. I do realize that there's much greater issues that Director Adamson is wrestling with that have to do with impacts associated with the construction and worker behavior and the worker camp, things that the regional district and the community have very little influence over. I'd also just want to point out to board members that representatives from Trans Mountain are on the meeting today. They're attending the meeting, and should the board want to ask any questions, that might be possible to hear from Trans Mountain representatives.
Thank you, Director Adamson. And I noticed that it looked like Kate Stebbings had indicated that she wished to speak, but that happened after Director Adamson spoke and put a motion on the floor, and after we had closed the public hearing portion. So you are correct, Director Adamson, that it would not be in order to allow Ms. Stebbings to speak right now in relation to the item. We did call for comment, and they did not avail themselves at the time we called for that comment. But we heard from Director Daniluz there around some of the experience that staff have had. So Director Dixon, did you have a follow-up to that?
I just clarification if I could.
Go ahead.
So we have some say whether or not we can continue the temporary use permits for the pipes, but we really have nothing to do with the housing and the construction that is going on. That appears to be where the concerns are. Am I accurate in that?
Ms. Kinnaman, it sounds like that may be out of our jurisdiction.
Through the chair, Director Dixon, yes, I believe that is an accurate statement.
Thank you.
Thank you. And I don't see any other comments. This is for EAs. So are you ready for the question? Just a reminder that the staff recommendation has been moved and seconded. So I'll call the question. All in favor?
So if you vote in favor, you're voting staff.
You're voting for the staff recommendation. That's correct. And if you vote against, you're opposed. So I'll call the question. All in favor? And opposed? 1, 2, 3. I see the motion carries. I saw, I counted 4 and 3. Yeah. Yeah. I counted 4 and 3. Yeah, the motion carries. Ms. Van Ness, just to clarify with our corporate officer,
Sure,
she has the same count.
I have Director Bales, Director Davidson, and Director Adamson in opposition. Is that correct?
Yeah.
Yeah, and the
And-
motion passes.
Okay, the motion passes and the TUP is issued. Next item.
Thank you. So the next item is 10.5, which is special event permit for the Thirsty Elk Trail Race in Electoral Area E. And just to-
Moved.
Mr. Chair, there's no public input for this item.
Pardon me?
And just a note that it does fall under the permits, but there is no
No
public input. Yeah.
Thank you. Okay. This is for all. And do I have a mover and a seconder?
So moved, Engar.
Engar and seconded. Yeah, Director Adamson, and discussion.
Yes, please, Chair, if I may. Yes, thank you. I think the community will be happy to host this event at the end of the run, and it sounds like an exciting event if done well. I should note that we have some very narrow roads out here, and I'm a little concerned the shuttle locations on the maps may impact the community negatively. So I've spoken with the Chilliwack River Campground manager, and his area is going to be traversed by the run. And he said that he'll put me in touch with we'll have a walk around with the applicant. So with the caveat that we have that opportunity to fill the applicant in on the best location for the shuttle buses and to make sure that things run smoothly, I would like to support this event. Thank you.
Thank you. Another comments on the item? Director Clute.
Thank you, Mr. Chair. I'm happy to help facilitate a director's team. I will not be taking part, but I'm happy to help you guys get that arranged.
Thank you, Director Clute. No other comments on this item? Ready for the question? All in favor? Opposed, if any item carries. Yes. Director Adamson. Yeah, sorry, Director Adamson, you're out of order. That item is being passed. She named the people that voted in the negative. And the 3 people that indicated they voted in the negative were named. Yeah, that's okay. No. Next item, Ms. Kinnaman.
Thank you. 11.1 is an information item. It's the first quarter update for 2022.
Thank you. Any questions on the first quarter update? Again, lots of work, and appreciate the effort the staff put into this and giving us kind of a succinct overview of all of the things that are going on. Thank you. And I don't see any other questions or comments. So next item.
11.2 is the Sta'alis First Nation in the province of British Columbia Reconciliation Agreement.
Thank you. Again, an information item, and there was a number of directors and I took part in a meeting with representatives from Sta'alis, along with Ms. Kinnaman and some of our staff, and just congratulated them on this significant achievement. But any other questions or comments? Seeing none, next item.
11.3 is also an information item. It's the Island 22 Regional Parks boat launch update. Happy to answer any questions.
Thank you. And any questions on this information item? Just again, thank our staff, our park staff, for the excellent work on this item. And I know they also indicated some really good collaborative work with the city of Chilliwack, assisting in moving the gate, and with some work with the province to facilitate that, to ensure that our sport fishing folks are happy. And again, very good work there. Next item.
11.4 is Canada Day 2022 for Hope and Area Recreation. As many of you know, we have a new manager of recreation in Hope, Joe Dixon. And I'm sure many people in the Hope and area are very excited about the return of this event.
And may I say, we've been saving our money for a couple of years, so it's going to be big.
Excellent. Looking forward to it. Any other comments on this item? Hearing none. Next item.
11.5 is the Federal Disaster Financial Assistance Arrangement Review. Again, just an information item.
Thank you. Any questions on this item? I don't hear any. Next item.
11.6 is the results of the 2021 Atmospheric River Response Public Survey.
Thank you. And any questions on this item? Doesn't look like it. Next item.
11.7 is the Volunteer Fire Department's 2021 statistics.
Thank you. Any questions on this item? Very busy departments across the region. And of course, we all thank all of our volunteer departments and the key role that they play, especially throughout this last year. I don't think there was a busier time where we really counted on their efforts. So really appreciate that.
And don't see any other questions. Next item.
11.8 is deployment of volunteer fire departments for out-of-region wildfire events. There's a motion for your consideration.
So moved, Mr. Chairman.
Thank you. That's moved by Director Facio, seconded by Director Blue. Questions or comments? Hearing none, all in favor? Opposed, if any, the item carries. Next item.
11.9 is the anti-racial discrimination and anti-racism policy. There's a motion for your consideration.
Thank you. That's moved by Director Lowen. Did I hear? Yes. And seconded by Director Popov. Discussion. Was that a discussion, Director Mercer, or ready to go for the vote? Okay. All in favor? Opposed, if any, the item carries. Next item.
11.10 is the radon testing and awareness in the Fraser Valley.
Thank you. That's moved by Director Horn and seconded by, did I see Director Ross there? Any comments or questions? Didn't hear any. Call the question. All in favor? Opposed, if any, item carries. Next item.
11.11 is Sumas Mountain Regional Park parking area license of occupation.
Thank you. That's moved by Director Stobart, seconded by Director Shahal. Discussion. Hearing none. All in favor? Opposed, if any, item carries. Next item.
11.12 is FVRD electoral area sanitary sewer gap analysis policy update.
Thank you. That is moved by Director Facio, seconded by Director Dixon. Discussion. Hearing none. All in favor? Opposed, if any, item carries. Next item.
11.13 is the Agricultural Land Commission application for a proposed 3-lot subdivision at 1095 Columbia Valley Road in electoral area H.
Thank you. This is for EAs. Is there a mover and a seconder? It's moved by Director Dixon and seconded by Director Adamson. Director Dixon, you wish to speak to Adam?
No, it's fine.
Good. Okay. Don't see any other comments on this. I'll call the question. All in favor? Opposed? Motion carries. Next item.
11.14 is the Cultus Lake Park Board request to implement changes to the Cultus Lake Park zoning bylaw number 1375.
Thank you. EAs again. It's moved by Director Dixon. Yeah. Second.
Actually, I think
No, I have a change. I have a different motion.
Oh, you have a different motion. Okay. Go
It's only
ahead.
slightly different actually, but I'm just pleased to put this forward that the Fraser Valley Regional District directs staff to expedite changes requested by Cultus Lake Park Board to the Cultus Lake Park zoning bylaw number 1375 2016 as part of the 2022 FVRD work plan, and that Fraser Valley Regional District allocate $30,000 to provide staff resources to undertake changes to zoning bylaw number 1375 2016, not previously included in the 2022 work plan.
Okay, and that's moved by Director Dixon. Is there a seconder? Seconded by Director Dickey. And comments?
I got a question. Thank you, Chair.
Okay, Director Adamson.
By taking this extra work on, are we losing something?
Through the chair to Director Adamson, no. Staff has been working through the process and with the Cultus Lake Park Board to find a way to add this to the work plan without causing any disruption to other previously decided projects.
The comments from board directors, questions? Ready for the question? All in favor? Opposed, if any, item carries. Next item.
11.15 is electoral area C official community plan scope and strategy.
Thank you. Mover and a seconder. Okay, yeah, it's moved by Director Adamson and seconded by Director Dixon. Any comments or questions from board directors? Nope, we're all good. Okay, call the question. All in favor? Opposed, if any, item carries. Next item.
11.16 is the British Columbia Social Procurement Initiative. There's a motion for your consideration.
Thank you. It's moved by Director Pranger, seconded by Director Horn. Discussion. The opportunity to hear from the BCSBI at RACS, and there's an opportunity for our staff to look a little bit more into this
initiative. Call the question. All in favor? Opposed? If any, item carries. Next item.
Moving down to item 15, which is reports by board directors.
Thank you. Board directors, now would be your opportunity. And I'll just check in with directors online. We'll start there. So do you have anybody on Zoom who has a board report? Going once, going twice.
Yes, if I may, Chair.
Go ahead, Director Engar.
Just very briefly, I'd like to say that we're having some success with our Fire Smart approach out here, and thanks to our new Fire Smart coordinator, we've had a chipper truck running around Slessy Park this last Monday, and very successful. I think 56 cubic meters of wood chips have been ground up and taken away. So most homeowners are getting on board and really doing their best to try and be fire smart and take a precaution as we head into wildfire season. So very great to see, and something that I've been looking forward for a long time. We hope to expand out from here and do more. Thank you.
Thank you, Director Engar. Director Bales.
Hi, that the FERD Fraser Valley District Board directs staff to investigate opportunities for the tree cutting bylaws for the electoral area C as part of the FERD's work bylaws plan. I would.
Sorry, Director Bales, I just want to clarify. It sounds like you'd like to introduce a motion. Is that what that's your intent right now? And that's what you just read out? That you introduce a tree cutting bylaw in the work plan for area C?
I would suggest it goes to the next east for consideration.
Director Bales, I think that's a great suggestion. I think maybe if we could, maybe if you put a pin in it and introduce it at EASC for further discussion. Staff have heard, I kind of got the gist, I think, of what you'd like to speak about, and so they can better prepare for the next EASC and then have it ready for in advance of board. So if the board is going to truly consider something like this, they can have all the information in order to make a good decision. Does that sound? Okay?
Yeah.
Okay, perfect. And check in with directors at the table. Any Director Horn, go ahead.
I recognize that it's rather late, but this is worth reporting. I'm happy to report that thanks to a very generous donation, a $550,000 contribution was made to the CT scanner fundraiser, getting us extremely close to our target mission.
Excellent. Thank you, Director Horn. Director Popov must have been feeling especially generous that day. Director Adamson.
Yes, thank you. Area B is kind of busy and getting busy. Yale Museum opens May 1st to October 1st. Come on up and check it out. The thrift store in Yale is now open, but they're going to be selling hot dogs and pop for $5 starting Saturday, June 18th, and every Saturday, day 4th through the summer. Where am I? Last Friday, I had the opportunity to go to this documentary that was shown in Hope about one of the Sunshine Valley citizens, Hippie Mike. And what Hippie Mike is, he's a part of the skateboard culture, and he's built this fantastic indoor skateboard park in the old lumber store in Hope. It's just amazing what he's done in a short time. So they made a documentary of Hippie Mike and this project and all about community. It was all about community, and it was very moving actually. And it was professionally done. It was 45-minute long documentary, and it was very well attended too. Area B is going to be giving $5,000 to Hippie Mike to put on a special skateboard day in next 2 months, I think, sometime the end of May or sometime in June. We haven't got a date down yet, but we're sponsoring this event. And from the last one, I didn't stay very long because I get headaches from loud noises, and the noise was really loud. These people were having a real good time. and it keeps kids off the street. It's just a great thing. And economic development. They bring money into the community. So we're going to be doing that. And then I just want to say, Tajmi Museum has opened. Right now, they're only open Saturdays and Sundays, 10 to 4. As the summer goes along, they have a student coming, so they'll be open every day. But definitely worthwhile going, since we at the board here have supported this museum, and they've put in some new things since last year. So there's new stuff to see, and that's it, I guess. Thank you.
Thank you, Director Adamson. And just wanted to recognize that I did get an invite from Hippie Mike to the premiere of the documentary. And unfortunately, I was sick and couldn't go, but definitely one of the things that I had highlighted in my calendar. Might I suggest that you look at Tuesday, June 21st, which is National Go Skateboard Day, as being the day for 21st of June. So National Go Skateboarding Day. There you go. And
June 22nd is National Get Your Hip Repaired Day.
Yeah. And yeah, maybe I'll mark that in my calendar. Be something I try and attend. So thank you, Director Adamson. Any other comments or board directors? Because I come from a family of skateboarders, believe it or not. There you go. Yeah. And any other further board director reports? Oh, Director Stobart, sorry.
Thank you, Mr. Chair. I just wanted to thank staff for the amount of time and effort they put in trying to effect some flood repairs in my area. It's gone on for 4 months. We're getting closer, I believe, finally this time, the 15th time. They've had to deal with, I think, every provincial agency that exists over the time, and it's just dragged on. And I especially want to thank for the work that they've done with the Common First Nation and making things move as smooth as humanly possible, given the province and what's going on. But anyhow, thanks to staff, we're getting there.
Thank you, Director Stobart, and thank you for continuing to raise that important issue. And it is, it's frustrating, but it is also heartening to see the lengths that our staff are going to, and really working alongside some of the First Nation communities with some of the challenges. So that is the good news part of that story. Any other reports from board directors? Don't see any. Ms. Kinnaman?
Thank you, Chair Lum. So we move to public question period for items relevant to the agenda. Jamie Van Ness.
We have received no questions. We have no members of the public left with us in person or on Zoom.
Thank you. Next item.
Looking for a resolution to close the meeting.
It's moved by Director Facio, second by Director Popov. All in favor, opposed if any item carries.
So if you could just give us a couple